నమస్కారం అండి. నా పేరు వీరేంద్ర పాటిల్. ఐఎమ్ పీడియాట్రిక్ hematologist, oncologist and bone marrow transplant physician in Basavatarakam Indo-American Cancer Hospital and Research Institute, Hyderabad. Uh, to speak about childhood cancer is a rare disease, but looking at the population becomes very important for us to know more about childhood cancer. This is a type of cancer which happens in children. These some of the very different types of cancer which are seen in children, like blood cancers, brain cancers, solid tumors, which includes renal tumors, abdominal cancers, soft tissue cancers. So these are some of the cancers which are seen in children less than 18 years. Among them, blood cancers are the most common, which are also called as acute leukemias. These usually children present with very vague symptoms like persisting fever, bone pains, or joint pains, or becoming pale, or complaints of back pains, becoming very tired, very early tiredness. So these are some of the vague symptoms usually seen in children, and they which do not indicate anything about childhood cancer, but keeping suspicion about cancer is very important. Whenever you find something of that sort, that routine evaluation and routine treatment by the pediatrician is not making the child normal, and if you find that the symptoms are persistently increasing, usually evaluation for childhood cancer starts. And if there is any suspicion, you should be immediately reaching to the cancer hospitals. Uh, Coming to the incidence, the cancer as such is rare, and among them, childhood cancer is very rare, we say. It is seen in about 3 to 4 lakhs of new children which are diagnosed, every year, and when it comes to all over world. But when it comes to India, in India itself, we may see around 50 to 60,000 new children diagnosed to have cancer every year. But the facilities which are available to treat these children are very less, because it's only in the tertiary or quaternary structures we find facilities to treat these childhood cancers. Uh, so the next important thing which should be known about is there are so many different types of treatments which are available. It includes chemotherapy, surgery, radiation therapy, and in some situations where we use bone marrow transplantation as the treatment options for treating these children. So regarding the success rate, we say that all over world, the success rate for the children with cancer, when treated properly, it approaches around 80%. It means that 80% of the children with cancers, when treated properly, they get cured from this cancer, and then they live life normally. But unfortunately, in low and middle income countries like us, the success rate has not been to that level where we see in high income countries. So that is mainly because of attrition, mainly because of financial problems, mainly because of parents not pursuing the treatment properly, or the facilities which are not available to treat these children with good proper care. So it is very important as a public to be aware of this condition and get the treatment properly as and when required. Thank you.